Let us talk about the oncogenic viruses. Oncogenic viruses are the viruses which cause the tumors in the human being. So, our focus is to describe the oncogenic viruses. As you know, the tumors are not uncommon in the human beings, and some of these tumors the viruses or the causative agents of these tumors. So come to describe these viruses. These viruses are divided into the two categories, which those which belong to the DNA, or these are the DNA viruses, and the RNA viruses. Regarding the importance of the neoplasia, approximately 1 in 6 human cancers are is caused by the tumor viruses. So these tumor viruses are divided into two, the DNA viruses and the RNA viruses, and these are the families of these viruses. DNA viruses which cause the tumors in human beings, they are four in number, and these these are the herpes variety family, and the second family is the papo variety family, and the HAPA-DNA variety, and among the RNA viruses, the Flavi variety and retro variety. So these are the different families, and the DNA viruses causing the tumors are four in number: the human herpes virus 8, the Epstein-Barr virus, and the human papilloma virus, hepatitis B virus. While on this side, the RNA viruses are the two in number, the hepatitis C virus and the human T cell lymphotrophic virus. So, four viruses on among the DNA and the two viruses among the RNA, and, are able to cause the tumors in the human beings. So let us to see the forward. The DNA viruses, the mnemonic for the DNA viruses, to remember these oncogenic viruses, DNA oncogenic viruses, is the he or she is my papa or mama. So you have to remember these DNA viruses causing the tumors by this mnemonic. The hepatitis B virus, number one among the DNA virus. The Epstein-Barr virus, which is also called the human herpes virus 4, and the human papillomavirus, the papillomavirus, and the sarcoma associated herpes virus, which is also called the human herpes virus 8. So the sarcoma virus is the human herpes virus 8, while the Epstein-Barr virus is also called the human herpes virus 4. So this is the 4, and herpes 4, and here is the herpes 8. And the Merkel cell polyomavirus. So there are the five viruses, DNA viruses, which cause the neoplasia, the tumors in among the human beings. Among the RNA viruses causing the tumors are hepatitis C virus and the human T cell leukemia virus. again subdivided into HTLV1 and HTLV2. So there are the two types of human T cell leukemia virus. This is a human T cell leukemia virus divided into subtypes 1 and 2. Among the DNA viruses, the most common important oncogenic DNA virus is the papilloma, human papilloma virus, and this causes the several types of the cancers. And you will be looking at this slide that the human papilloma virus causes the cervical, oral, and penile, vulvar, anal. So the different types of the tumors in these different sites. So this is much more important among the DNA virus which causes the neoplastic changes, the different types of the cancers among the human beings. The human papilloma virus causes the cervical cancer. So it is the common cause of cervical cancer worldwide, and in the females it is the fourth cause in the female cancer days, and the second most common cancer uh, among the females which are aged 15 to 44 years. Uh, Here is the statistics. The statistics is a very alarming situation. It states the alarming situation that a single woman dies every 2 minutes. So, so it is the human papilloma virus causing the cervical cancer, and cervical cancer is the the females are at the higher risk. So human papilloma virus is the much more important among the oncogenic DNA virus. Let us describe the different serotypes, the different types of the human papilloma virus. It has the different serotypes and the type 1 through 4. From 1 to 4, the human papilloma virus causes the plantar warts. The warts on the soles of the feet, and the human papilloma virus 6 to 11 is the cause of the anogenital warts, which are also known as the condyloma acuminata and the laryngeal papilloma. And the human papilloma virus 16 to 18 is the cause of the cervical carcinoma and the penile carcinoma. So the different serotypes, the different types of papillomavirus are causative agents of the different neoplastic growth, and the this one is the much more this the human papillomavirus 16 and 18. The females are at the higher risk, the cervical carcinoma, the carcinoma of the cervix. How the human papilloma virus causes the oncogenesis, how the neoplastic changes, the neoplasia is caused by the human papilloma virus. The this virus encodes the two genes, the E6 and E7, and these genes, they suppress the genes, normal tumor suppressor genes in the human beings, which are present normally at the cellular level. So the P53 and the retinoblastoma gene, they are suppressed by the these two genes encoded by the papillomavirus. So this is the way how the oncogenesis occurs in the human papillomavirus. And the important thing to note is that the primarily the human papillomavirus infects the keratinizing or the mucosal squamous epithelium anywhere in the body. So it infects the skin as well as the mucosal surfaces. The second virus, DNA virus, which causes the tumors in the human beings, is the Epstein-Barr virus, which is also known as the human herpes 4, and the lesions, the which are caused by this virus, are the infectious mononucleosis. This is also called the glandular fever or the kissing disease, and and this is an infectious disease caused by the Epstein-Barr virus. And the tumors are the Burkitt's lymphoma, the B cell type lymphoma, the nasopharyngeal carcinoma, thymic carcinoma. These are the three tumors, different three tumors which are caused by the human herpes virus 4. And how this virus causes the tumorigenesis, the oncogenesis, the in this virus, there occurs the translocation of the cellular gene, which is present in the human beings at the cellular level, and the translocation occurs at the chromosome 8 to 14. From the 8 chromosome to the 14, the translocation of this cellular gene occurs. So this is the way of oncogenesis in case of the Epstein-Barr virus. Hepatitis B virus, this is a DNA virus, and this causes the hepatocellular carcinoma, previously known as the hepatoma, and this causes the hepatocellular carcinoma. Uh, the protein which is encoded by this virus, the hepatitis B virus, and this protein is called the HBX protein, and this suppresses the tumor suppressor gene, that is the P53. So this in this way, this causes the neoplastic change in the liver. Human herpes virus 8. This virus also is a DNA virus, and this causes the Kaposi sarcoma. And this Kaposi sarcoma is a vascular endothelial tumor. Most common, it is a most common cancer in patients with acquired immunodeficiency syndrome, and the one of the protein which is encoded by human herpes virus 8 is the latency associated nuclear antigen, uh, and this antigen suppresses the normal genes, the p53 and the retinoblastoma gene. So this is the path by which the human herpes virus 8 causes the oncogenesis. The Merkel cell polyomavirus is the virus which causes the skin tumor, the carcinoma of the skin, and this is called the carcinoma of Merkel cells in the skin. This causes the tumor of skin in those areas which are exposed to the sunlight, such as the face and neck. And one of the antigen which is present in the Merkel cell polyomavirus is the T antigen that interferes with the tumor suppressor genes. Likewise, the previous virus. So this is the this is the pathway by which this causes the neoplastic growth. Let us describe the RNA viruses, which are oncogenic, and these are the this one is the human T cell lymphotrophic virus HCLV. This causes the cutaneous T cell lymphoma, and the another disease which is autoimmune disease which is caused by this virus is the tropical spastic paralysis. This is autoimmune in origin. It is autoimmune disease. However, this one is the cutaneous T cell lymphoma. This is a tumor. This is a cancer, and which is the pathway by which the HTLV causes the this cutaneous T cell lymphoma. Eh, It has the special genes, and these there are the two genes, the TUX and the RAX, that regulate the transcription and translocation. So they cause the change in the T cell, the cutaneous T cell, causing the lymphoma, and this virus infects the CD4 T cells, CD4 T cells, which are the lymphocytes, the helper T cells, and so the HTLV causes the oncogenesis, and they have the affinity. This virus has the affinity for the CD4 T cells, that which are the helper cells. The hepatitis C virus, which is a RNA virus, while the hepatitis B virus was the DNA virus. So the hepatitis C is also implicated in the oncogenesis, and this once again likewise the hepatitis B virus causes the hepatocellular carcinoma, and how it causes the carcinoma, hepatocellular carcinoma. It causes the chronic hepatitis, which will lead to the cirrhosis and lasting in the carcinoma. So the B and C both are the viruses which are the causative agents of the hepatocellular carcinoma. Let us see this table which summarizes these viruses, the oncogenic viruses, and the way by which they cause the oncogenesis. Look at these different viruses. The B, hepatitis B, suppresses the P53, and the Epstein-Barr virus, there is the translocation of the chromosome, the cellular gene, translocation of the cellular gene, and the human papillomavirus that once again suppresses the P53 and retinoblastoma genes, Kaposi sarcoma that also suppress the p53 and retinoblastoma genes. Hepatitis C virus as the different way of oncogenesis, the chronic hepatitis leading to the cirrhosis, and then the carcinoma of liver, and the human T cell lymphotrophic virus has the specific protein in the genes, the tux and rex, which regulate the transcription and translation. So this is the summarized table of the oncogenic viruses and their the way by which they cause the oncogenesis. Thank you very much for listening.